So we're going to start our regular adjustment based on the fact that we took x-rays and have everything all squared away on what adjustments you want to do on a regular basis. So we would go into our assessment and say the patient responded and tolerated well. And then from there, we go to plan and say that we adjusted everything and everything was performed as it's supposed to in the treatment plan. And we're going to do drop C4, supine T4, and then side posture L5. Then we're going to do our exercises, use cervical restriction, resisted, and you're going to exit. We're going to do that for 15 minutes. And then we hit save as regular adjustment. It shows up in this blue box at the very top. So now we're going to do a daily note based on this. We go back in and we have our questions already set up. And we have our issue of driving 8 hours, numbness in left hand, and neck pain. And since we set those up and we clicked only the issue that was related to the functional loss, the questions that we have written in the system are based on functional loss, not pain. So you could actually click on the question to start with, and we're going to say we're going to use the Medicare insurance questions. We're going to go ahead and make sure that's the right one. We're going to run subjective. The first question is, do you feel your ability to drive 8 hours has improved since your last visit? We think it's better. How much better are you improving? Compared to your last visit, let's say it's 30% better. How much has your condition improved since you started care? Let's say it's 60%. We're all set. Now we have our subjective in there. We go to objective, and we're in their first 12 visits, so we can click CTL because we're adjusting cervical, thoracic, lumbar, and all of our objectives are listed here. So we have improved posture based on no change, worse range of motion, all the findings that are usually what we're going to find on a regular basis. So we can click on this, that today's exam findings show much improved cervical, thoracic, lumbar range of motion as compared to the visit before. And also that there's increased range of motion, significant improved posture. And then we hit our regular adjustment, and we're done. And that's our entire visit, and we can hit Dr. Riddle signs off, and then we can go back and look at our note for the entire visit. And if we look at our visit for today, we go all to the bottom. We have everything right here. As far as, do you feel your note, do you feel your subjective here? You feel the ability to drive 8 hours is improved? Yes. Our objective is listed as far as what we found today. Our assessment is listed. Our plan is listed. Supine, side posture, resisted cervical, everything here, no electronically signed by. So here, in the matter of hitting only 3 buttons, once we set up our regular adjustment, we have our daily note completed.